Hi, Stephanie.
Hi.
How are you? So we have a patient, AS, and it's a 56-year-old female. Admit date was October 14th. Diagnosis is diabetic ketoacidosis, and the chief complaint is general weakness, headache, right groin tenderness for a few days, and she's had no surgeries. The background, her medical history, she has diabetes, and she has no allergies. So what we got from assessment was she has LOC times 4, she doesn't appear to be in any distress. Perla, she has it's fatigue with activity, and she does have dizziness, and then her respiratory, her lungs are clear to auscultate bilaterally. There's no rhonchi or wheezing. She denies shortness of breath. There's also no asthma noted. Her cardiac S1, S2 with no gallops, bruise, or JVD. She has normal active bowel sounds, tenderness and swelling in the right groin, and no abdominal pain. She is positive for UTI. Average built, ambulated with the walker, and the skin appears to be intact with no edema, moist pink mucous membranes, and clear sclera. The vital signs, including the pain, she did have mild pain. Her temperature was 97.7, pulse was 137, BP of 186/71, and her O2 sat was 96, respiration was 10. We did do blood sugar checks at 8 o'clock, and we got 160. We administered 2 units of regular insulin, and then it was 210 at 12, and we administered 2 units of the regular insulin. Okay, do you have any questions?
No, thank you.
No problem.
Okay, so for this patient, my priority system is going to be neuro, just because she has a headache. My secondary system is going to be cardiac, and my third is going to be skin. Okay. All right. Oh. Okay, so neuro because of her headache and her generalized weakness. Cardiac because of her high blood pressure. And skin because it's so closely related to cardiac and she's at risk for skin breakdown. Okay. Knock, knock, knock. Hi, my name is Stephanie. I'm going to be your student nurse today. Can I get your name and your date of birth, please?
Alyssa Salas, 7/25/89.
Okay, can I see your bracelet? Perfect, thank you. Can you tell me why you're in the hospital today?
Because I have a headache.
You have a headache. Okay. And do you know who the president is?
Obama.
Okay. And do you know which hospital you're at?
Western U
Okay.
Hospital.
Great. Perfect. Thank you. Okay, so do you have any allergies?
No.
Okay. All right. Good. So GCS 15, LOC times 4. She's able to answer the questions. She's aware who she is, where she is, why she's here. She also has motor response when she hands me her arm to show me her bracelet. So I'm going to take a look at the room. There are a couple trip hazards around her, so I'll be sure to take care of those. And she's not on any oxygen. She doesn't have any IVs hooked up to her or anything like that. So you're having a headache. Can you tell me when your headache started?
A week ago.
A week ago. And where on your head? Is it like in the front, in the back?
It's in the front right here.
Okay. And so it started a week ago. Do you have it all day, every day?
It kind of comes and goes.
Okay. Is it worse in the morning or the evening?
It's worse in the morning.
Okay. And what does it feel like? Is it stabbing, throbbing?
It's definitely throbbing.
Okay. And is there anything that makes it better?
Aspirin.
Okay. Is there anything that makes it feel worse?
Lying down.
Okay. Does radiate anywhere? Do you have neck pain or back pain or anything?
No, it stays.
Okay. And on a scale of 1 to 10, would you, with 1 being the least pain and 10 being the worst pain you've ever felt, how would you rate your pain?
4.
Okay. So I'm looking at my patient. She has adequate nutrition. She has erect posture. Alyssa, can you stretch out your arms and move them like this? Okay. And let me have you stand up and take a few steps for me. And then walk back. Thank you very much. So her range of motion is intact, even steady gait. She has a calm, cooperative mood, and she doesn't have slurred speech. She's able to communicate well with me. So I'm going to take a look at your hair. So I don't feel any lumps or bumps in her hair. Her hair is clean and free of vermin. Thank you very much for being clean and free of vermin. Like I said before, she's not hooked up to oxygen. She doesn't have a nasal cannula. She's not wearing glasses. If she was, I would take a look behind her ears and at the bridge of her nose to see if she has any skin breakdown there. And if she did, then I would pad the area with some gauze. While I'm looking on the outside of her ears, I don't see any discharge. Do you have any trouble hearing me? Okay. She also is not wearing a hearing aid. If she had trouble hearing, then I would speak louder. I would stand on the side with her hearing aid. Okay, so now I'm going to take a look at your eyes. Okay, so I would have my pen light with me, and I'm going to shine a light into your eyes. Just keep looking forward at me, okay? Okay, very good, very good. And this side, okay. So your pupils are round and reactive to light, just like they should be. So keep an eye on the tip of my finger, and just follow my finger. Okay, and her eyes accommodate. Now look out far away. Okay, perfect. And her eyes are accommodating. So Perla for her. Do you have any nasal discharge?
No.
Okay. Do you have a history of a deviated septum?
No.
Okay. So I don't see anything coming out of your nose. There doesn't seem to be any sort of occlusion.